My son, I'm being discharged today.
Are you?
Yeah, do you know when my son's coming?
I do not know when your son's coming. You seem okay.
I'm just waiting for my son. We don't need to talk. My son's coming. I'm being discharged. Yeah, my son's coming today.
Okay. Is there something bothering you? Can you tell me what's bothering you?
I just don't want to be around people. I don't want to go to group. It scares me.
Tell me more about what group. Tell me more what scares you in group.
Everybody looks at me. They laugh at me. I'm scared to go to group.
No. Do you think that we could sit down and talk?
I don't want to sit down.
You don't want to sit down?
Nope.
You said you haven't eaten yet today.
I'm just hungry.
You're just hungry. What are you hungry for?
They're telling me no flesh and no bones.
What's that?
Not sure.
You're not sure. Have you eaten at all today? No. You're gonna go this way?
Yeah.
Okay.
Every day because if I do play the lottery, then I'm gonna win. And the guy on the TV is telling me to do it. All my friends here are telling me to do it.
All your friends? So there's just more than just the people on the TV and the lottery? Are you talking to them right now?
Sometimes.
Sometimes?
You talk too much. Shut up.
Oh, Katie, is Kylie bothering you?
Yes.
How is she bothering you?
The voices are telling me she's bothering me.
The voices are telling you that?
Yes. The
Okay.
voices are telling me to keep talking.
Okay.
They're telling me to be quiet.
Katie, would you like me to talk to you separately and away from Kylie?
Yes.
We can take a walk where Kylie and Kylie can stay here. Is that okay?
Yeah.
Okay. We can move down here.
I don't want to. They tell me to kill myself.
Do you have thoughts of suicide? Or
Not right
harming
now,
others?
because I'm here. There's no animals here to tell me that.
Can we contract for safety?
Yeah, I won't.
If you
I
have any
don't.
thoughts of suicide or harming others, please report it to a nurse or a staff member.
I'm okay right now. I
Okay.
feel pretty good. I'm just a little sad.
Tell me more about what's making you sad.
I'm just scared. I'm just scared of people. I don't really like to go to groups. I'm nervous.
Does them
When are we eating supper?
I need my clothes and my purse and my pills.
in about 2 hours? Have
Are we
you
having
been-
pizza?
Yes, I think so.
I'm good. I really
Yeah,
like
it's
pizza.
pizza day here at Torrance.
I'm just really sad. I'm just really sad.
Okay. Tell me more about what's making you sad. The people laughing at you?
Yeah, I just know people laugh at me.
What do you think they're laughing about? I just know.
Telling me that nobody here likes me.
Do you believe what they're saying?
Yeah.
How does that make you feel?
Makes me upset because I get along with everyone, but they just tell me that nobody likes me. So
Do other people show that they don't like you?
I don't think so, but I feel that they do because of what the voices tell me.
Do you talk to anyone here besides the voices?
Not really. I keep to myself a lot.
You keep to yourself?
Yeah.
Do you like to stay in your room a lot?
Yeah.
Yeah.
Because nobody likes me.
And you believe that just because of the voices?
Yeah.
How long have these voices been around?
A long time. Years.
Years?
Sometimes I can deal with it and push it aside, but other times it's so overwhelming that they just take over everything and I listen to them.
What do you do to push the voices aside?
I do what I have to do. I mean, sometimes I'll get a book out or I'll listen to some music.
What type of music do you listen to?
Anything that I can find.
Do you have a specific genre that you like?
No.
None that you...
No. Just anything. Or whatever's on TV, but then sometimes when I'm watching TV, the people on the TV will tell me that I have to go play the lottery.
Is that when you read a book?
Yeah, and I'll shut the TV off and go find a book or magazines, anything that I can.
What's your favorite book to read?
I like romantic books. I have the series Numbers. It's one of my favorite books.
Can you tell me about that?
It's about people looking at other people, and when they look at them, they can actually see their death date, and they will follow them around, and that's what the whole series is about. That's really interesting.
How many books are in the series?
I've read 3 already.
Miss Emprey, we were here yesterday. We're the student nurses with Commonwealth School of Nursing. I'm Alyssa, this is Katie, and that's Kylie.
Good morning. Good morning. You seem upset. What's wrong?
Just leave me alone.
Did something happen this morning?
No.
You seem sad.
Well, wouldn't you be? If you lost your husband of 50 years?
That would be upsetting.
And now they want to send me to a psych unit. Everybody gets sad, don't they?
Yes, everyone does get sad.
Just leave me alone.
We're just here to help you.
Nobody can help me. Can you bring him back? Call my daughter. I want to get out of this place.
We can call your daughter, but we have to wait for the doctor to tell us what to do.
He can't tell me what to do. I already know I have colon cancer. I'm going to die. I know. You need to leave me alone.
You still feel as if you have colon cancer?
Yes. Nobody can tell me any different.
Yesterday we told you that the test came back all negative.
But sometimes they lie.
Have you talked to your daughter recently?
I don't want to talk anymore. You can call her and tell her I want to go home. Can you get her?
We can call your daughter, but it's up to the doctor to let us know when you can go home.
But you can't keep me here against my will.
All we want to do is make sure you're safe.
I am safe. Leave me alone.
We want to help you feel better.
Then treat the cancer.
All the tests came back negative.
They lie.
You feel as if the doctor's lying to you?
I'm done talking. You need to leave me alone.
Wilda, we just want to make you feel better.
Before we leave, can you tell me maybe how your anxiety is today?
I don't have anxiety. I don't want to be talked to. Nobody understands.
Okay, all right.
You feel as if no one understands what you're going through?
That's what I said. Why aren't you gone yet?
We're here to make sure that you're doing okay.
I'm fine.
Have you eaten breakfast this morning?
I'm not hungry.
Are you having any pain today?
Of course I have pain. I have cancer.
Where's your pain?
Where is colon? Where's your colon?
Can you rate your pain from a 0 to a 10, 10 being the worst pain?
It's bad today.
Are you able to describe it?
It's just bad. It just hurts. Are you guys going to leave yet? Go get my daughter. I want to go home.
We're not able to bring your daughter here. We can call.
Why? She's my daughter.
Once we get in contact with her, we'll let you know, okay?
All right, then you need to go do that now. I want out of here. I need to go see another specialist if these people here don't believe me.
You feel as if no one believes what you're going through is true?
I already said that. What's going on here? You need to leave me alone. I'm done. I'm not talking anymore.
Is there anything that we can do?
No. You're still here. Please leave me alone.
Well, then we just want to make sure that
Leave me alone.
if we call your daughter, will that make you feel better?
You already said you would. Now, please leave my room. I want to be left alone.
thoughts of self-harm?
What does that mean?
It means, are you having any thoughts of harming yourself or others?
Or others? Why would I hurt somebody else? And no, I don't want self-harm, I just want left alone.
Okay. I just want to make sure that you'll be safe if we leave you alone. Wilda,
What?
will you be safe if we leave you alone?
What am I gonna do?
Is there anything we can do before calling your daughter?
Leave me alone.
Just leave you alone? You don't want water, food, I can get you a snack.
I'm not hungry. I'm getting very agitated because you keep asking me questions over and over and over again.
I just want to make sure that you're comfortable.
Do I look uncomfortable?
You look upset.
I am upset. And I don't want to go to this geropsych place. This is ridiculous.
The geropsych unit will help you feel better and work towards
I can
getting...
go home and deal with this. I want my husband back.
Why don't you tell me about your husband?
I don't feel like talking. I want left alone.
Did we give you your meds today?
Somebody gave me some new pills this morning. I don't know what they are.
Was it one of the pills that we gave you yesterday
I
that
don't
helped?
know. I can't remember. Okay, so end scenario. First thing you should have done when you came into the room.
Introduce
So you did, right? We all that. And then what did she present to you?
She was upset.
She was left alone. She was tired. So what should you have done immediately in the psych evaluation world?
I should have contracted for safety at that point,
Right,
not later on.
because you, obviously, yesterday, what was she like? More what? More anxious and talkative. Today, she has done what?
She's become more upset and shut down.
Withdrawn, doesn't want to go out, or wants to socially isolate. So immediately you walk in and say, are you having thoughts of harming self? And then contract for safety. But what didn't you do that you should do on a normal day, like when you walk in? What other than assessing emotional tone and assessing that component? What didn't you physically assess? She's being held here,
Vital
and
signs.
yeah, assess vital signs, see what's going on with her as well. And I understand you don't want to talk about that right now, but can you mind if I listen to your stomach, because she's still complaining of whatever. Now, she is going to be discharged, but geropsych has no beds. So she's being held here until they can find somewhere for her to go. That's why she's still where she's at. So we moved from medical to more of a psych evaluation. So, but we still have to assess vitals and make sure, because she was put on 2 new meds yesterday. How long does it take that antidepressant to work? The antidepressant,
Was that for,
Oh, and the
2 to 4 weeks?
Yeah.
it's anywhere from 7 to 21 days. So obviously it's not taking care of her depressive piece of it. We gave her what yesterday for the anxiety? The diazepam. So would we give her something like that now? Is she appearing anxious versus? No. So we probably wouldn't do that, but you would worry about what her change in emotional tone was. So safety, again, is number one. Assessing the medication, you can't really do anything other than make sure she's not having like adverse effects to that drug. Is it making her like sleepy? But the full effect of turning the emotional tone and mood around is not going to happen for a couple of weeks. So what are you going to do when you walk in? You're going to have patients that are going to tell you that all the time, just don't bother me. I mean, if you do work in mental health, and I know other people can attest to it, that you go in and they're going to like leaving the heck alone, and you practice that, right? Between the two of you, don't talk to me. What did you do while you were talking to the voices? Can I come back? Did you say to her, once you contract for safety, I'll let you rest for a couple minutes, and you knew she was safe, walk away, because all you do is worry, poke questions, what happens? It'll increase the agitation and stuff. So once you knew she was safe, you did your assessment, she currently didn't want anything, okay, how about if I let you rest for another 15 minutes, so come back whenever maybe you feel a little bit, or we can talk about what's going on.
So the second that they say, leave me alone, I don't want bothered, is that the second that you?
It's not a second timing, like if she says, I don't want to be bothered, leave me alone, and some of the things, the phrases you're trying to get is that exploring, those pieces that you wanna do and say something like, what happened that's different from yesterday to today? Or are you having thoughts of hurting self? Are you feeling uncomfortable because you do want the safety factor, but you wanna see there's a big change from yesterday to today. So she's still going through a grieving process that she probably hasn't happened since the death of her husband, how many years ago?
I thought it was 3 months ago.
Okay, so 3 months ago, 3 months ago was the anniversary of her husband's death that triggered it. He had died prior to that, so the anniversary happened, so she probably hasn't grieved the original death, so she has to go back through psychiatric treatment to learn how to go through that grieving process, and yes, you're gonna be sad on those days. I mean, you're in a memory, and you see these things on social media all the time, 1 year ago, blah, 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 but she should be able to move forward and say, okay, I'm okay. But what happened to her, she started turning in her sadness into physical symptoms yesterday, or a couple months ago. Like the daughter started noticing the doctors, she was calling the doctors every day, calling the daughter all the time, but then when they ruled out any kind of medical problem, then we knew that there was a psych component that she really has not grieved, and it was a trigger for her at this given time because it was a big anniversary. So she gave you a lot of good triggers that were going on.